Okay, so this is AP and PA with the patient lying prone. So it's just an alternative method of doing it. So with the prone, knee flexed, and then we're going to, again, using the webs of our hands. So I'll start off with the same as I did earlier. So a PA, so we're going to come in behind. You can either go from the web kind of through in this position here, or if you find that difficult, you can put it just in between your thenar and hypothenar eminence of your hand, and then fixing onto the anterior surface over the distal tib and fib. So we can go in this position here, elbows nice and high, and then you're using your chest to pull your hand in this way. So you can either push like that or like that. This is perhaps a little bit more pure, but if you find this difficult, try the other way. Okay, so we can push, and we're going to do our test range. I'm testing the range there. Obviously we'll be asking for pain checks as well. Then my grade 1, again, more perceptible as movement of my arm than it is of movement of the joint. Grade 2, emphasise coming off. Grade 3, find resistance and go through. And grade 4, small amplitude towards the end of range. For AP, we're going to swap our hands over. So this hand now becomes the proximal control, and this hand becomes the distal. So we need to make sure we're just in the front here at the talus, and exactly the same thing, just in the opposite direction. So this hand going from anterior to posterior. Testing the range. Then we're going to do grade 1. Outer resistance, remember. Grade 2, emphasise coming off. Grade 3, find resistance and go through. Grade 4, towards the end of range. Right, so this is the talocrural passive accessory movements now. So AP, anterior to posterior, and PA, posterior to anterior. So there's two positions for this. We're going to start off with them supine, but then I'll also show you the prone position. So in supine, what we're going to do is we're obviously going to fix the proximal end, distal tib and fib. And when you fix it, they need to have this foot position so that the heel is only just off the edge of the bed. So that as you fix, what you can do is you can actually clamp that leg into the bed, so they almost become part of the bed, so there's less likely going to be movement of this proximal end. For a PA, so posterior to anterior, you come underneath the foot, just take it up into a bit of dorsiflexion, not end of range because we want a slightly more loose pack position, holding on to the calcaneum. You can't get to the talus, so we'll have to go via the calcaneum, and then you're going to pull upwards. So you're pulling up a little bit like an anterior draw. So nice firm grip, and now use your body and shoulder to pull this upwards. So fix and then pull upwards. Okay, testing our range. And then for our grade 1, it's going to be very, very small. You'll actually see, again, more arm movement than you would actually see motion at the joint. Grade 2, if you try to emphasise the coming off and then back on for your motion. Grade 3, so now we need to find resistance and go through it. And then grade 4, towards the end of range, nice and small. Okay. For AP, same thing, gripping and fixing into the bed. Now my hand's going to come on the top, across the talus here, so we can use the web of the hand into the talus, so that's going to be my direction of force. If I just push like that now, all I'm going to do is push it down into plantar flexion. So what I need to do is use the rest of my hand to grip underneath the foot and pull it up into dorsiflexion. What you'll find is as it brings my wrist round here, if I can get my body over the top of my radius, then the force will go down through my arm, through the radius, through the carpals, and directly onto that web of my hand. Okay, so in this position here, my body is right over the top, into dorsiflexion, and then I can apply my AP glide, testing the range. Coming off, now my grade 1, small amplitude. Grade 2, emphasise coming off. Grade 3, find resistance and go through. And then grade 4, towards the end of range.